listening to the HumanCare podcast, part of the Invisible, Not Broken network. I'm your host, Eva Minkoff. On this show, I have candid conversations about chronic illness with both patients and practitioners. In other words, humans like you and me. I'm also the founder of Wellacopia, the matching site for healthcare relationships. Visit wellacopia.com to connect with your ideal medical or wellness practitioners. Today's episode is part 2 of my conversation with Sneha Dave, a powerhouse advocate, journalist, and community leader, who at 22 is already more accomplished and influential than almost any adult I know. On top of it all, she has ulcerative colitis. In continuation of her list of accomplishments, which you think I would have exhausted in part 1, Sneha created and now chairs the first and only Disability Caucus in Indiana, which recently developed a voting guide for people with disabilities used by campaigns throughout the state of Indiana. She is on the Democratic National Committee Disability Policy Subcommittee, that's a long title, where she is helping shape national disability policy for presidential candidates. Sneha also lobbies with Voices for Non-Opioid Choices, a nonpartisan group that is working to provide alternative pain medication options to patients. And lastly, Sneha speaks nationally, including on Capitol Hill, featured on C-SPAN. In part 2 of my chat with Sneha, we talk about the Health Advocacy Summit during COVID-19, the empowerment of young adults versus adults, especially in terms of mental health, and working with pharmaceutical companies, both the good and the bad. Before we get started, a reminder that all conversations and health claims on this podcast are based on individual experiences and expertise. Everyone has their own personal and professional truths and should be treated as such. Okay, let's get started. As for the Health Advocacy Summit, we are now, in the midst of COVID-19. I know it's an in-person event. Is there one scheduled for the near future, or?
Yeah, no, that's been very tough for us with the COVID-19 pandemic, of course, because it's kind of altered our entire plans and everything. But I think it's given us a lot of opportunity, to do a lot of different initiatives. So we've had to postpone. So we were in 2020 supposed to be in 6 different states. We were supposed to be in Massachusetts, New York, Illinois, Texas, California, and Indiana. However, we are, we're going to be postponing all of our summits for 2020. And so we have been doing weekly virtual meetings on Thursdays at 7 p.m. Eastern time. And those have been really nice because we've been able to connect with young adults that we hadn't met through our summits before. So, and it's also been really nice because a lot of the attendees that come to our weekly meetings are not, a summit site is not accessible to them. They kind of live far away from a summit site. So this is a way to keep connecting our community and supporting our community during this time. And then we're also going to be announcing that we're doing an international virtual summit this year as well. We haven't necessarily solidified the date yet for that, but this will be done kind of through a more sophisticated platform where we can accommodate speakers and different ways to connect young adults and keep empowering them to continue their lives despite the pandemic, because there is so many additional pressures, especially with school, navigating mental health, of course, during this time, but things like telehealth. There's just so many things that are just anxiety inducing during this time. And if we can connect young adults and show them that there's so many other people going through this and there are ways to navigate these situations, it's really exciting. So,
Indeed. And when it comes to empowering young adults, do you actually see a difference in how you would do that versus adults?
Yeah, definitely. So I think, the young adult age group is kind of a time where we often feel very invincible, and we want to be as quote unquote normal as possible, as in have the same experiences of, even going to parties, just doing different things that our peers are doing at this time. So I think there's particularly quite a bit of denial in this age group. And there's a lot of difficulty with independence and self sufficiency. So, one of the things that we really try to focus on is early intervention. So, trying to educate our young adult attendees about things like insurance, things like financial resources, but also providing that sort of, we don't necessarily provide explicit mental health support, but we do facilitate discussions by psychiatrists or social workers often who open up a session and have these young adults share about their unique experiences of isolation and mental health as it pertains to their physical health. Because unlike a lot of different locations, our summit sites like Indiana and South Texas, you can see there's a huge difference in the lack of addressing mental health as it pertains to physical health. So I think when we're talking about places like New York City, San Francisco, certainly there's a lot of work to be done in those areas, but there's a lot better access to mental health services, and there's a lot more encouragement for people to receive mental health services as well.
Yeah, I'm glad that it is starting to grow and starting to receive a better reputation. Not like it should have ever had
Right.
anything other than a great reputation, in my opinion. I am in a bit of a bubble sometimes. I forget that because I'm in New York City, or from New York City, and live in a very liberal world and open-minded world, and in the healthcare world. And I forget that
Mhm.
like seeking out mental health services still isn't the norm. It's really
Absolutely. Yeah.
boggles my mind
Yeah.
sometimes.
Yeah.
Yeah,
Definitely. Yeah.
and also when people are like surprised that our mind and how we think and how we feel can affect us physically. They're like, "Wait, that can happen? Are you?"
Yeah.
I
I know. I know. It is very surprising. I mean, you think that we would, especially children in particular, who are most vulnerable at certain points of their lives, would have mental health addressed in conjunction to their physical health. But it's just simply not the case, and we're still struggling with funding, enough therapists and social workers. I mean, I've never seen a social worker, but and I didn't really even know about the social work field until I started getting more involved in this transition and transfer of care for young adult patients. And so, I mean, I think social workers truly are incredibly powerful for this age demographic as well. Yeah.
Yeah, and it seems that that's actually a growing field, which I'm really
Yeah.
happy about. And they don't get paid enough, but that's a separate problem.
Oh my gosh.
Just like
Yes.
teachers.
Right. No,
Most
yes,
helpful
yes.
people in the world don't get paid enough.
No.
That's
Yeah.
the world we live in. Uh, what are what are a couple things you have learned since starting all your advocacy work that have surprised you?
Yeah. So I think definitely the top thing is the lack of addressing health equity within patient advocacy specifically. I think that right now the patient advocacy space has not really tapped into addressing marginalized and minority communities. And so I think there is a bit of tokenism right now with a lot of different patient advocacy organizations, but there's not a fundamental and deep understanding of diversity and the importance of patient advocates and healthcare organizations really fully representing patients, and particularly patients who are low income of various racial and ethnic minorities. And so, and even rural communities. So I think that I was kind of surprised to see that because you know health affects different communities very disproportionately, and you can see that minority communities are particularly affected by health disparities. So I was hoping to see a little bit more of that within the patient advocacy space and within the healthcare and medical system. But of course, that has not been addressed, and that's something that I'm particularly passionate about. And of course, I think as patient advocates, we have to be really open and clear about not upholding the current system. So one thing that I'm passionate about, so I've interned at Pfizer in health economics and outcomes research. I'm in New York City, and I've also done research in health policy. But one of the things that's been really interesting and fascinating to me is how the intersections of patient advocacy and pharmaceutical companies. And I've also been on Pfizer's patient advisory board and have done marketing consulting with Eli Lilly. But I think that this is an area that has to be addressed a lot more because it's just, being at Pfizer in their health economics department, it was really fascinating to see how maybe a lot of these patient advisory boards and a lot of these marketing ads are doing more maybe harm than good a lot of times
Yeah.
too.
Were there other people like you working with them?
At Pfizer,
Yeah, or Eli Lilly. Eli
um,
Lilly.
yeah, yeah. So when I was interning at Pfizer, to my knowledge, the only patient there, and I think it would be very hard to work in health economics and outcomes research as a patient at a pharmaceutical company because it is, um, uh, yeah, there's just a lot of issues that arise there, and I'm not sure how much I'm allowed to share necessarily, um, while I was on the Pfizer's patient advisory board, I think there were maybe two people of color, me being one of them, in a room of about 30 patients, which is just bizarre to me because I think access issues affect people of color disproportionately too, especially drug access in these different situations. And for Eli Lilly, I was like, I think only one of two patients that was doing marketing consulting for them. And I'm not necessarily proud of that stage of my life. I was 18, so I was like really excited that I was being asked to do all this. But I think as I've been more involved in this space and as I've seen how these big policy issues are affecting patients, a lot of my peers in rural Indiana, I mean, it really does make me question the way that we're currently working with pharmaceutical companies. And that's not to say that we shouldn't work with pharmaceutical companies at all. Obviously, we need their medications, we need their innovation in a lot of ways, but we have to recognize that there is a huge problem right now with drug access, and we need to be a little bit more vocal about that, as well as insurance companies, PBMs, hospitals. There's a lot of things going on, of course, but pharmaceutical companies happen to be one of the biggest donors to patient advocacy groups. So,
Yeah. In general, and I guess I'll tiptoe around it too, but when it comes to pharmaceutical companies, obviously they do produce, uh, life-saving drugs a lot of the time, and they do have a lot of money,
mhm.
and they have a long process in order to produce those drugs. I've been in clinical research myself, but I wish that there would do more collaborative work with patient advocates, and so that they can um, just understand on a more personal level. And I sometimes wonder if they're just doing it to look good or maybe just for
Absolutely,
marketing, right?
it is.
And
Yeah.
so that's why I was wondering, like, are there more people like you working with them? Like, is this, but
Yeah.
in a positive way? Um,
Yeah. No, definitely. And that's that. Yeah, I mean, I'm all for pharmaceutical companies making profits, just not hyper profits, especially because this is healthcare. I mean, this is not like the car industry. This is not like the real estate industry. This is affecting people and people's lives. And so we have to be a little bit more careful and sensitive when we are approaching these big industries to ensure that when we're there as patient advocates, we're not representing ourselves, but we're representing the mass majority of patients. And I just don't see that reflected right now within patient advocacy. And pharma's marketing is just off the roof incredible. I mean, they do a great job, but it's often misleading. And to have patients as part of that effort is a unique ethical situation as well.
yeah, it is, because in some ways you really want a patient's input, and like, yeah, it's incredibly important for so that, well, one, things will be delivered accurately,
Mhm.
and also that they will be marketed well. Because look,
Mhm.
if you put millions and millions of dollars into creating this drug for people, you do want them to take it, like, so it can actually help people. But there is
Right.
that fine line with advertising. And by the way,
Yeah. Yeah.
my mother is a pharmaceutical advertiser. Like, she
Oh,
which is,
wow.
it's kind of funny to me. It's funny to her because she kind of fell into it after being in, she works like for a big ad agency. And
Uh-huh.
so she jokes that she's a drug pusher. It's
Yeah.
terrible. Um,
That's yeah.
and she's all about alternative medicine also. So I just think it's funny. Um, But what I really respect about my mom's work is that she dives, so she's in the creative around it. She does like the research and the creative. And she makes sure that everyone on her team is so involved in
Mhm.
the the patient's lives, like really understands what they're going through, and like studies almost like they're scientists, even though they're creatives. And I don't know if she's ever had a choice in this. I assume not, but I don't remember the last time she ever had to work for a company, or like, she was helping with advertising for a company where she didn't fully believe in what they were trying to do, and
Mm-hmm.
really put her heart into it in a way that actually made me feel good about her work and made her feel good about her work. Um, so
Yeah, no, it's interesting. I mean, definitely a lot of times the marketing department doesn't have a choice because so when I was working in their health economics department, I didn't work directly with their marketing people at Pfizer, but I knew that there was a lot of cross communications between like the health economics people and the marketing people and everything. So it was really interesting being there, and it was really fascinating how like a major pharmaceutical company works and being there on the inside as a patient. So it's really interesting.
yeah, I've never worked with any directly myself, uh,
Mhm.
but yeah, it's a bit of a hard, like the lines kind of blurry in
Yeah.
where they're doing good and could be doing better or not so great. But at the end of the day, many of us need them, so I'm not going to dismiss
Yeah,
them.
yeah. No, definitely, definitely.
Yeah, actually, I don't want to say who they are yet because I don't know how far along they are, but I've heard of a couple companies now that are actually doing tests that help people determine which drugs in particular are right for them.
Yeah, the precision, yeah, medicine
Yeah,
approach. Yes, yes, yes,
it's
yeah.
so great because let's say you have an autoimmune disease, and like, which ones do you pick? Like, some
Yeah,
people, for instance, react really well to Humira. For others, it was like debilitating. So
that'd be
really
awesome, yeah.
cool to get some actual better genetic testing so that you don't have to go through that hell
Yeah,
in the trial and error.
right, right. No, I mean, that would be so, so, so exciting to see, and once again, just me being, like, the health equity person, I just think that or not the health equity person, but being an advocate for health equity, I just wonder how that would translate to ensure that all patients have access to something like that. Because patients who are especially lower in socioeconomic status already struggle to see basic physicians and stuff. So there's just a lot of work, but it is really exciting all the innovation that's happening, and it's really cool to see how fast it's happening too.
Thanks for listening to another episode of the HumanCare podcast, part of the Invisible Not Broken podcast network. If you haven't already, please take the next 30 seconds to do these 3 things. Hit our subscribe button, leave feedback with a review, and share this episode with a loved one. Don't forget to check out our official Invisible Not Broken Network Facebook group. Please join us in our community conversations where you can ask questions, connect with fellow invisible illness peers, and make suggestions for the podcast. Visit facebook.com/groups/invisiblenotbroken. And this link will, of course, be in the show notes. Also, if you ever want to submit a question or suggestion directly, feel free to send an email to chronicillnesspodcast@gmail.com. Thank you again for tuning in and being part of our mission to transform healthcare into human care.